Good afternoon. I'm Erin Vignay, Director of Clinical Affairs at AMDA, the Society for Post-Acute and Long-Term Care Medicine. And on behalf of the Society, I thank you for joining us for this first in a series of roundtable discussions to develop practical, concrete strategies to grow and strengthen the post-acute and long-term care force. During the COVID-19 pandemic, leaders like you joined together to share ideas and strategies to best care for your patients and support the heroic but exhausted and sometimes traumatized staff within your communities. You saw firsthand how team collaboration, trust building, and compassionate leadership improve staff morale and in turn, patient care. Now we face a challenge that we knew was coming, a staffing crisis. But we have reason to be optimistic, and you're the reason. You have come together today to listen, share, and work together to put your ideas into words and words into action. So let's get started. Some of you may already be familiar with the 4Ms framework of the age-friendly health system, where we addressed four main issues: what matters to residents, mobility, mentation, and medication. This evidence-based framework has been successfully implemented in healthcare systems across the country to better serve older adults. But we all know that staff plays an integral part of any healthcare community. So we decided to expand these 4Ms to include staff. What matters to them? Opportunities for career mobility, mental health, and employee wellness and workplace safety. These roundtable discussions will address aspects of each of these. And now I'm delighted to introduce our moderator for these discussions, Dr. Joanne Snyder. Dr. Snyder is a seasoned nurse executive with more than 35 years of experience in clinical practice, administration, consulting, education, and research. She completed a postdoctoral fellowship in psychosocial oncology at the University of Pennsylvania School of Nursing and holds a PhD in nursing from the University of Maryland, a master's degree in nursing from Thomas Jefferson University, and a master's degree in business administration from George Washington University. Dr. Snyder has held executive and leadership roles in both for-profit and not-for-profit healthcare settings. Her clinical expertise is palliative and end-of-life care for older adults. She is currently a professor of health services leadership and management at the University of Maryland School of Nursing and an affiliate associate professor in the School of Pharmacy, where she created and teaches 2 leadership courses. Prior to this role, she spent 9 years as the Chief Nursing Officer for Genesis Healthcare, the nation's largest skilled nursing provider. Joanne, welcome.
Thank you, Erin. It's really great to be here, and welcome everybody to this kickoff of this really exciting series. And I want to throw back some kudos right to Erin Vignay, who's, as I said on LinkedIn the other day, this is the brilliant brainchild of that woman right there. This is a really exciting series, and we look forward to everybody's active participation. So before we get started, I'm just going to talk for a couple of minutes about some of what we'll call the rules for the road, kind of how we would like these sessions to go, and then we'll get right into a little bit of content for today and then a discussion that we want to have with all of you. So Erin, if you would run our poll question first, and I know everyone is familiar with Zoom, you know how this works. Go ahead and answer the poll question on your screen, and Erin will close it out once we see that most people have responded. I also wanted to point your attention to the fact that Erin is talking not about workforce, but about care force. And I do want to credit Lori Porter, who is the co-founder and CEO of the National Association of Healthcare Assistants. It's Lori who came up with that term, and she used it recently in a meeting with HHS Secretary Becerra, who by the end of the meeting was also calling the workforce care force, which we just really love. And so we've adopted that too. And I invite all of you to do the same. Erin, how are we doing with our poll? Okay, well, that's easy. Thanks very much, everybody. It's interesting. I put together the poll, and I know, of course, how critical staffing is right at the moment. Building our care force, building back our care force is one of the most important endeavors for everyone working in post-acute and long-term care right now. I didn't think it would be 96%, compared to everything else that you're working on out there. But it shows us, and it shows you, Erin, that you really hit on a nerve with this important application of the 4M's concepts and framework to developing our care force. So if you'll go ahead and go to the next slide, I'll just go through a couple of points about sort of what it is we're hoping to accomplish here. Also want to give credit to this beautiful CNA whose picture appeared on a billboard in New England during the pandemic, and it was to encourage people to mask up. She's a CNA who's working for Genesis Healthcare at the time. So Erin and I like to say that we're crowdsourcing the collective intelligence of the group, people who are close to and sensitized to the care force issues in post-acute and long-term care. That's you. That's why you're here. And we really want to invite you to engage with us to co-design a set of principles, ideas that Erin can, with others, disseminate at the end of this series so that we can sort of scale this effort to build out care force again. We're borrowing from Project ECHO. Some of you have probably participated in those, maybe during the pandemic or maybe previously, out of the University of New Mexico. This notion of all teach and all learn. Everybody has something to share. Everybody has something to learn. And frankly, everybody, regardless of your role in post-acute and long-term care, has a role in developing the culture and the environment that we really need, the stickiness that's going to allow us to attract new people into our setting and to engage them and delight them so that they'll actually stay there. We're going to invite you by the end of this program today to think about what you've heard. What one thing did you hear that you could take back to a team in your setting and encourage them to think about, apply, do a small test of change using the Institute for Healthcare Improvement's language? And then finally, we're going to be collating and disseminating the insights. As we go along, Erin has some platforms where she'll be sharing information, and certainly at the end, we'll be putting out that information. There's Lori Porter. Yay! So glad that you could join, Lori. If you could go to the next slide, please, Erin. So this is the format. We're going to have 6 monthly gatherings. They're short. They're 45 to 50 minutes. Short presentation to stimulate you to really get those creative juices going and to have some ahas come out of that presentation. We'll do some question and answer with our featured speaker for that particular program. And then we're going to do a breakout session. Those will be facilitated today by Erin, by me, and also by my colleague and good friend, Wendy LeBate, who is a Senior Vice President for Quality and Customer Experience at Genesis Healthcare. She'll be in the third breakout room, or maybe the first breakout room, and working with that group. So these will be smaller groups. We're going to break up that way. And the idea is to really generate and collect experiences, ideas, insights, to hear from you what's working. We can always focus on what's not working, but let's hear about what is working. And then we'll debrief at the end of this meeting to collect some of those things. And you all can think about the strategy or the tactic that you heard that you want to apply. And we'll talk about that next time when we come together in May. Next slide, please. Coming up next week, I'm really delighted to let you know that Dr. Beth Lone will be with us. She is the Chief Medical Officer at the Schwartz Center for Compassionate Healthcare. If you have never heard her speak, you do not want to miss this. And if you have heard her speak, you still don't want to miss this. She is just an exceptional human being. And the message of compassion that she brings, and not just ideas, but how to actually practically bring compassion into the workplace, is one that you don't want to miss. So please join us in May, and Dr. Lone will be with us. Next slide, please, Erin. And now it is my pleasure to introduce to you our speaker today, Emily Nicoli, who is the Chief Nursing Officer for United Healthcare Retiree Solutions. She is a nurse practitioner, board certified in adult and gerontology, as well as hospice and palliative care. And she leads a clinical team in the areas of clinical quality, clinical program oversight, and the development of customized initiatives to improve retiree outcomes. Prior to her work at United Healthcare, she worked in leadership roles for Optum. So you may have heard Ms. DeColi speak at the opening general session of AMDA's annual conference this year, where she participated on a panel to discuss the current staffing crisis in post-acute and long-term care. And her practical ideas really resonated with many in the audience. So we're delighted to have Emily here today to help kick off the More of a Good Thing initiative. Emily, over to you.
Thank you, thank you. Appreciate the warm welcome. All right, so we will hop right in. Erin, if you are able to put up the poll. So I just kind of want to get a sense of how the attendees today break down in terms of what is your current role in the post-acute long-term care setting, and then what is your level of experience. So we'll give you a couple seconds to fill that out. You're right, NP is not an option. Thank you, Dr. Baker. All right. So mostly under other. So that actually is, unless it's mostly nurse practitioners, the other kind of surprises me. Okay. And then nurses and medical directors. That's good. Okay. And no nursing assistants. That makes me a little sad. But that's okay. Hopefully we can get some more engagement over time. And you're right. Not currently employed is also not an option. That is a good call out as well. So in terms of, if we can move to the next slide. Unless it's just me that's frozen. So this slide might look, I'm sorry, go back one. It might look a little familiar to you. We went over this at the National AMDA conference. So this slide was actually made by the wonderful Dr. Catherine Evans, who is my mentor. And so I decided to steal it again for this presentation because I liked it so much. So what I really like about this is that just, we have all of these circles around the patient. So ultimately we are putting the patient at the center of everything that we do. And these smaller circles that are surrounding that patient, there is not one circle that's bigger than the others. We all have equally important roles in making sure that we are caring for the older adult in the way that they need to be cared for. So it doesn't matter whether you're a nurse, you are a attending or a medical director, whether you work as an activities director, your role is still as equally as important as anyone else's. Next slide, please. So again, I think we're all pretty well versed here in the 4 M's framework of the age-friendly health systems. So overall, I mean, we know that the number of older adults, individuals age 65 and older, that population is growing rapidly. And as we age, we know the care becomes more and more complex. And health systems are really not prepared for this complexity. And we know that older adults tend to suffer more harm at the hands of the healthcare system as opposed to other populations. So this is a pretty big challenge. And so to address this, back in 2017, multiple different systems came together to work on this age-friendly health system, the 4 M's framework. And so really looking at using evidence-based practices to make sure that we are not causing harm to the older adult and aligning with what we do to what matters most to the older adult. So I have them up on the screen. I won't belabor the point. But if we move to the next slide, how do we apply this to the care force? And again, shout out to Lori Porter for coining that term. So we broke it down, Erin broke it down. So for what matters most to the care force, to staffing. So really looking at facility culture and respect. Under medications, looking at this from more of a health promotion perspective, and then also streamlining some of these tasks that we're asking our care force to do. under mobility, so opportunities for growth and career advancement, and then undermined the well-being of staff to reduce burnout. So all of these things, all of these M's really should be implemented together in your facilities to help which will ultimately improve the care of the older adult in the facilities. And these actually have to be practiced reliably too. So, you know, I think all of us have experienced where if you're in a large facility with a couple different units, that maybe there's a unit that you prefer to go to. The culture on that unit is a little bit better than the one over here. And so we need to make sure that that culture extends to all locations in that facility. So doing a little bit of a deeper dive. So looking at what matters most. So as was mentioned earlier, I did speak at the National AMDA conference back in March on a panel that was facilitated by the FMDA president, Dr. Diane Sanders-Cepeda. And when I mentioned being kind, she paused and she said, well, what does that mean? And it put me on the spot a little bit, because you think that people know what it means to be kind, but I think that sometimes we lose sight of what that actually means. And so being kind is really understanding what the impact of our words and our actions, that impact that we have on others, regardless of the intent. And it's realizing that when we miss the mark, it's apologizing and promising to do better the next time. Some other examples of being kind include taking the time to remember the names of the staff in your building, the nurses and aides. I can't tell you how many times I've talked to other providers and they say, oh, the nurse over on 2 East. And you're like, well, which one? And they don't know. They don't even know the name of the people working in the facility. That's a problem. We should know everyone's names of the people that we're working with. Sometimes it's as simple as saying, thank you, or I appreciate you, or you are a valued member of our team. Again, I realize this is really basic, but when was the last time that you said those words or you heard those words? Might be a good way to judge how often that's happening in your facilities. I think also saying, again, not to belabor the point, but are you okay? So I think we all also know that working in the post-acute and long-term care setting, pretty much any setting the past 2 years has been incredibly stressful and incredibly trying. And nurses and aides and physicians, a lot of people are burnt out. And so sometimes just doing that quick check-in, are you okay? What can I do to help you? That really goes a long way. I also have on here diversity, equity, and inclusion interdisciplinary work groups. So we know that DEI groups promote workplace culture because it shows that we value every employee's individuality, and it also creates a culture of acceptance and belonging. And then when you pair that with the next bullet, the corporate social responsibility, meaning kind of, group volunteerism, giving back, we actually see better employee engagement. So those are two, pretty quick and easy things that you can implement in your facilities to help drive engagement and improve culture. Collaboration. So what can we learn from one another? So Dr. Snyder said earlier that all teach, all learn. It's true. We really can learn something from everyone. We should all be lifelong learners. You would be amazed at some of the things that I've learned from the aides, little tricks of the trade, if you will, to make things go a little bit smoother or easier. So during our breakout sessions, that's something that I really want you all to focus on is what were some of those learning opportunities for you that you learned or that you were able to give back to somebody else. And then if you're not sure if you're meeting the mark on this, elicit feedback from the team. If we're not asking them if what we're doing is working, then how do we know? And I'll round out the slide with saying this kind of circles back to be kind, but you encourage what you tolerate. So if you don't have a great culture and you know that you have certain individuals within your facilities to be direct, that are toxic. We all know people that are toxic. If you know that you have people in your facility like that, if you are tolerating that behavior, if you have people that are mistreating the nurses and the aides and others within the facility, that's a problem. And that change needs to come from the top down to stop that behavior. All right. So moving on to medication. So, again, we're looking at this more as a health promotion perspective. And so really going back to the basics. So working to ensure that your staff are provided adequate PPE. I feel like, again, this is something that should go without saying, but as we all know, there were massive PPE shortages, especially early during the pandemic. With that said, people don't want to go to work if they're worried they're going to catch a communicable disease. So let's make sure that you have adequate PPE in your facilities. Proper equipment in good working order. So we know that physical activity in the elderly is incredibly beneficial. Even just for a few minutes a day, there's been shown to be benefit. And just sitting upright in the chair is even better than them just sitting in bed. But we can't expect the staff to get these members up on their own if they don't have the right equipment. So let's make sure that they have gait belts, they have Hoyer lifts. We have things to help to reduce some of that physical strain on the nurses and the aides in the post-acute long-term care setting. And then I put bladder scanners on here almost more as a joke. I feel like they're so rare in the nursing home at this point, but whenever you have one, I don't care if it's the hospital or the long-term care setting, they're always missing or they're always broken. Doesn't matter the setting, they're always disappearing or broken. So if you have one, make sure it works. They're a very nice thing to have when you do have them. In terms of just overall health and wellness, the elusive bladder scanner, yes, Timothy. See, others feel the same. So in terms of health and wellness, having good medical and dental benefits. Something to call out here, again, I obviously work for a health plan. I work for United Healthcare, but even though I work on the retiree side, so the Medicare Advantage side, many commercial carriers actually offer fitness and wellness benefits. They're included at no cost to the member. So see if that's something maybe that you guys can leverage to help to improve health and wellness in your staff. Something that seemed to resonate back at the conference in March was more robust parental leave. I know I said this then, and I'll say it again. If I had to come back to work 2 or 4 weeks after I had my son, I would have been a basket case. So let's make sure that we're taking care of our mothers. It's mostly women that are working in this setting. So let's make sure that we're taking care of the women that after they have a child, they're able to come back to work and provide care to someone else. You can't pour from an empty cup. Social meetings. So I know that this might sound kind of cliche, but I did actually work in a facility that had a yoga club very early in the morning. And so the nurse manager would actually kind of cover the floor for a period of time. And it was only like 20 minutes, but the staff would actually go into the dining room, and they would move the tables, and they would do aerobics and yoga just for like 20 minutes. And at first I was like, no one's going to actually be interested in that. They loved it. They loved it. You had people coming from different floors. They would come and do it. And they went back to work, and they were energized. They were happy. They got to see each other for a little bit and just hang out. So that was something that I saw in real time that really made a difference for the nurses and aides in the facility. And then 2 other just quick things, looking at having healthy snacks in the break room. I don't know how many times I've eaten graham crackers in those little peanut butter cups when I was stressed out and just needed a quick snack, but let's do better. Let's maybe have fruit or, some healthy popcorn, something like that to maybe try to fuel ourselves a little bit better. And then encouraging a non-working lunch. I would love that myself these days, but I think that's something that we should all strive for. One more quick note on medications. So I know we hit on this very briefly earlier, but care we know is often very task-oriented in the post-acute and long-term care setting. So how do we minimize the number of tasks that we're asking people to do? So really focusing on, ordering daily weights, these 3 times a day temperature checks, or 4 times a day finger sticks. Do we really need to do that? And on occasion, maybe we do. Maybe you do have that very tenuous heart failure patient that, that is, very important for them. But for the most part, it's just not going to happen. So let's really try to be mindful of the amount of time that we're asking the nurses to be spending on these tasks. And just in general, when you're placing orders, what is the impact overall to time? And if you don't know, elicit feedback. You might be surprised at the orders that you're putting in that are difficult. Just as a quick example, the way that I was ordering steroids, for whatever reason, the way that the EHR picked it up apparently was a huge pain for them to even just put in. And so once they told me, I was able to change what I was doing. So that might just be, again, just another quick example of how we can try to improve things from a task-oriented perspective. All right, so for mobility, so opportunities for growth and career advancement. So something that you could look at doing, I know that, funds are obviously tight, resources are tight, but look at maybe doing some continuing education funds and using that specifically on the care of the older adult. It's a great opportunity to have more involvement in AMDA and GAPNA. And I do hope, I mentioned this again back in March, I hope AMDA takes us up on the idea of allowing nurses and aides to come for a discounted rate to these conferences. I think there's, again, just so much that we can all learn from each other. Is there a glide path or clinical ladder for professional growth within your facilities? And I put on here specifically, leadership does not have to equal management. There are people that are great leaders, but they are not good managers, and that's okay. That's an okay thing. You can have leadership positions where people can really thrive. So a good example for me, I look at wound nurses as a leadership position within the nursing home. There were many times, I enjoy wound care. It's something that I like. But these nurses have received special training. And so I really learned a lot from these nurses. And so a lot of the other staff would go to them for questions. So don't minimize maybe what a leadership position could be. Other ideas would be a resident council liaison. So I know one of my facilities had a nurse or an aide that performed in that role, or even someone who's there to drive a culture change. So, someone who's running a DEI group, the facilitator for that, or a corporate social responsibility group, that could also be a leadership position. And then again, if you're not sure if you're missing or if you're hitting the mark, elicit feedback. So ask your staff, what do they want? What would be helpful? Because if it's not on here, is it something that might be even easier to implement and you just don't know because you haven't asked? And then finally, that brings us to mind. And so I was just at a all-day leadership meeting earlier this afternoon. And one of the things that came up was paid time off. So who is using it and who's losing it? When I noticed in previous roles, when I had nurse practitioners on my team that had not taken PTO in 6 months, I got worried, because if you're not taking time for yourself to rest and recharge, that's ultimately going to lead to a problem. Obviously, we can't force people to take PTO, right? And unfortunately, because maternity leave isn't great here across the board, a lot of women end up having to save their PTO for their maternity leave. But outside of that, again, just be mindful of that. And maybe it's just a reminder of, hey, I saw that you haven't really taken any PTO the past couple months. Do you maybe want to schedule a couple days off? Sometimes people might just need a little nudge to do that, as a reminder to take care of themselves. Regular check-ins and debriefs following stressful events. This is something, especially over the last 2 years, I feel like goes without saying, but even before the pandemic, when we would have residents pass away, that's hard on us as the provider. It's harder on the people that are caring for these members day in and day out. So when you have a resident pass away, for example, check in on them, check in on your staff, on the nurses and the aides, and just make sure that they're doing okay. This is really hard. These people become like family. So that check-in is just a really kind thing to do. And then again, finally, eliciting feedback. And this is something that I think, ideally you all will discuss in your breakout sessions, but how do we better show compassion for our teams? How would you like to be shown compassion from your team? And with that, I am finished. So thank you so much for your time. And if you have any questions, please do not hesitate to ask.
Thanks so much, Emily. There was lots of good conversation coming through in the chat. which I know you couldn't really follow while you were speaking, but some really
no, only a little bit.
Yeah,
So,
some good
guys.
ideas in there as well. Request for the slides, and Erin, do you want to say a word about where the slides will be after this program?
Absolutely. If you go to AMDA's website homepage, www.paltc.org, you'll see there's a resource page we developed that's more of a good thing. And when you click on that from the homepage, that's where it will take you to where the slides will be, and also the recording of the main session. We're not going to record the breakout sessions because we want people to speak openly and honestly, but we will be saving the chat. So if you don't have a chance to talk during those breakout sessions, please put your thoughts in the chat, because we will save those and then summarize those for the resource page. So thank you.
Great. Thanks very much. Any questions for Emily? I'm going to, you can raise your hand or put something in the chat if you'd like to, or just unmute yourself and ask. And while you're thinking about that, I'm going to go ahead and introduce what we're going to be doing in the breakout so that we can move into those and make sure that we keep to time. But we'll certainly pose a question to Emily if someone has one. So you're going to automatically be assigned and moved into a breakout room, and you'll be, as I already said, with Erin or with Wendy or with me. There will be 3 breakout rooms. And so we'll have a smaller group, and what we want to talk about is what you're actually doing. A shout out to my colleague and friend, Wendy Lebate, who's here with us today. Some years ago when we were doing some work on care force retention, and instead of asking, you know, why are people leaving and what's happening and exit interviews and all those things that we find so important, she sat down with people who were working on the front lines and said, what's retaining you? What are, you know, not everybody's leaving. What are we doing here that's really, you know, creating that stickiness? So that's what we wanted to hear from all of you. What do you know about what's happening where you're actually interacting with front lines, or what have you tried in the past? What do you know about that organizations are currently doing to retain employees? And then based on what you heard from Emily's presentation, what you'll hear in the breakout, and what we'll summarize at the end, what one action can you commit to putting in place before we meet again in May? So any questions? Let me quickly go through. I don't see any hands raised. Okay. So Erin, I think we are ready to go ahead and move into breakout, and then we'll automatically be moved back. We'll do a little bit of debrief at the end, and then we'll let you go on time. Thanks. See you over there. So thanks everybody. That we had a great conversation in our little group. And yes, Tim, it is like teleporting. It's like, so why don't we do a quick summary, Wendy, Erin, and I'll make a few points too quickly, sort of what you heard. And I heard some folks in the breakout I was in saying, oh, here's something I'm going to do when I go back. Here's something I'm going to do by next time. So who wants to start?
Sure, I'll jump in. So we didn't get to question 2. 58 seconds, boy, that was fast. But what my team is going to do is enter into chat what the one thing is that they're going to take away and absorb. But in terms of just talking about what they're currently doing, some very basic things in terms of flexible hours, transportation considerations, and childcare considerations. But also I think in general, what I kept hearing was how important it is to create a culture of respect, that every care team member has a place and contributes, and recognizing that and really, you know, building relationships both with the staff as well as with the patients, giving people the opportunity to grieve when we lose someone, having some structured conversation about what it feels like, and to just be able to help people through those difficult times. So Great. That's a quick one.
Thanks, Wendy. Those are important messages. Erin, were you hearing similar things, or anything that sort of builds on or is different from what Wendy just shared?
Sure. Our group talked a lot about leadership. We had Andrea Moser from Canada and Lori Porter spoke about, you know, the role of the medical director and the trust that people place in them, and that they really need to, you know, be out there on the floor and be a role model for compassionate care to patients. And then Lori Porter makes some great great comments, as always, about leadership is we can't just keep relying on leadership, that it is a peer-driven community, and that we really need to look to strengthen the relationship and trust between CNAs and the nurse leaders, the DONs, the charge nurses, and build that trust and mutual respect there. And I think also, and I know, Joanne, you've looked into this, developing some leadership training courses for our DONs. I think they pluck them out of nursing school, and we're short on nurses. They get into a facility for a few months, and all of a sudden they're the DON. And so we're setting them up to fail. Frankly, without any leadership training at all. And it's not that they, you know, don't want to learn. I think if we provided that or figured out a way to do that and help them succeed and learn from each other, we'd be in better shape. And that would also help the relationship with the CNAs.
Great. Well, I heard very similar things, as well as a really great story that Diane shared with us about cross-training. Almost sort of in the sense of the universal worker, not going quite that far, but really getting, you know, people who don't necessarily hold a license or certification for caregiving, also getting engaged in some of the activities where they can, that can help as well. Well, I knew this was going to go fast. We knew this was going to go fast. I'm going to turn it back to Erin to close us out. And we thank you so much for participating today, and really hope to see you on the roundtables ahead while we continue to craft this.
Thank you so much, Joanne, and thank you for facilitating today. Thank you, Wendy, as well, and Emily, for your terrific presentation. As I mentioned, these will be posted on our webpage on the More of a Good Thing landing page at paltc.org. Please join us on Thursday, May 26th, to hear Beth Lone speak about compassionate leadership. You won't regret it. I know this was talked about probably in all of your breakout sessions. She's going to be terrific. My daughter is graduating from high school that morning, but this is so important to me that I will go from there to come onto this call, because I don't want to miss Beth either. So I hope you enjoyed today. We really look forward to having you come back, and I'll be sending out a survey as well. We have a few short questions for you to answer so we can better plan for May. Thank you so much. Have a good evening, everybody.
Thanks, everybody.